is a mental health crisis in America. Many people dealing with mental illness have been forced onto the streets or into jails. Now there are renewed calls to tackle the issue. Some psychiatrists and bioethicists at the University of Pennsylvania have proposed a controversial solution: bring back the psychiatric hospital. For many, psychiatric hospitals or asylums conjure up images of lobotomies, electroshock therapy, and inhumane treatment. But some mental health experts are now discussing whether a more humane version could help the roughly 1 in 5 Americans with mental health issues. Others point to successful community-based models of treatment as the most effective. So joining me now to discuss all of this is Dr. Ralph Aquila and Betty Eastland. Ralph is the medical director at Fountain House, a community-based organization focusing on mental health. Betty is a mental health advocate and has helped young adults with schizophrenia and bipolar disorder reintegrate into society. Betty and Ralph, thanks to both of you for being here with us today. If you could first remind us why asylums were largely disbanded in the 70s and the 80s.
So what you're referring to basically is the institutionalization, and hospitals were closed for many of the reasons that you had already spoken about, and that we were hoping to give people hope and new opportunities. And I think that's really what we need to do. So if you come to Fountain House, for example, and Betty could tell you about her experience, you will see a beautiful place, looks like a President's Club, where we address the issues of very serious mental illness, schizophrenia and bipolar disorder, people that were on the street. But you come into this beautiful place, you're treated like a human being, you are brought to different opportunities. We try to get people back to work, we try to get people back to school. We talk about a community system of care where we provide the medical, the psychiatric, and most importantly, the community, a place to be, a purpose,
right,
and a place where people can start to flourish and really recover. And
this is a model that is voluntary, correct? I mean, people opt into this differently from these asylums where people were essentially locked up. Betty, can you tell us a little bit about what is happening now to so many of the mentally ill? They're ending up in prisons, and what happens there? Or they're ending up on the streets?
So I can tell you a little bit about what happens to a person when they're diagnosed with a mental illness. Most people are diagnosed early in their lives. They usually get symptoms of mental illness before the age of 25. And when they're diagnosed, a lot of the times people, particularly with schizophrenia or recurrent bipolar disorder, and things that people develop psychosis, they are told, you're not going to work, you're not going to go to school, you're not going to have children, you're not going to have a life. So make your life small.
So basically they're rendered hopeless.
They're rendered completely hopeless.
I just want to read some of these statistics because, approximately 1 in 5 adults in the U.S., and that's around, 44 million people, experiences mental illness in a given year. That's a lot of Americans.
But let's just specify. So depression and anxiety, which are serious illnesses, PTSD, which are also serious. But when we look at what really you see on the streets, we're looking at what we call serious mental illness, schizophrenia and bipolar. You're talking about 10 million people, which is a very large amount of folks.
And those people, though, who suffer from schizophrenia and bipolar disorder, what you're saying is they can still live functioning and, full lives with dignity as long as they have support, a community-based model like this. So you are both saying don't bring back the asylum.
Well, I want to be clear. I'm saying that for 99 point blah blah amount of people, we don't need the asylum. There may be someone who might need long-term hospitalization, and again, we have to take that case by case. But what we're saying is that the vast majority of people have not been given the opportunities, and thus that we don't really know what they could have been.
Right. And so this community-based model, that Fountain House is an example, how is it funded?
So our model is a private and public partnership. So we have, we get governmental funding, but we also have a lot of donors who have family members who've lived through, and many who have died from mental illness, who absolutely find our model something that would help their their families.
Well, you make a good point, because with 1 in 5 Americans, or slightly fewer depending on how you're estimating it, everyone is touched by this. Everyone has a family member, a community member who has a mental illness. And so you have to ask yourself, how would I want my family member treated if they were suffering from this? So this community-based model, it seems to not only save money because you're not relying entirely on public funds, it would also seem to alleviate the prison systems that now I think I have a approximately 20% of state prisoners and 21% of local jail prisoners have a recent history of mental health conditions.
Serious mental illness, like schizophrenia or bipolar.
And can they get treatment in prisons and jails?
Most do not get treatment when they're in jail, and that's just a shame on us, what's been happening. The 2 largest mental institutions in America now rotate between LA County Jail and Rikers Island right here in New York City.
And that's costing the city and the state a lot of money.
A lot of money, over $100,000 per person per year.
And you're saying this doesn't, not only is it not helping people, it's costing society more than it needs to.
And it's hurting the individuals who are in jail.
It's really disabling people, because you can't get a job very easily with a record, and people are getting put in jail just because they act differently.
So, so the community-based model of care for the mentally ill, how does it work? Can you explain it a little bit?
I can talk a little bit about my experience.
Sure.
So at Fountain House, you come in as a voluntary member, and there are many things you can get involved in. So there's no psychiatry or therapy on site. What it is a place where you can give back to. So for instance, when I first started there, I started working in the horticulture unit, and I just started watering plants. And then I realized they had like a mealybug infestation, and I'm such a country girl, and I whipped up this eco-friendly bug spray, and I taught the members and the staff how to use it, and we got rid of the bugs. So that's really astonishing, not because of what I did, but because I was valued as a community member with some talent to give, instead of a person who needs to be fixed.
What I hear here is that this is, a life of dignity is being offered to people that are not given that option normally, and they can lead productive lives, is what you're saying. So let's get back to the idea of the asylum for a moment. Do you think that there is any a redeeming value in bringing back a sort of a humane version of the asylum, because they were originally intended to be a humane place for people with mental illness to live?
Right, but I would specifically again say that when you offer a very well-funded and dignified community system of care like we have, because yes, you come into Fountain House and you're treated like Betty just said, but we also provide the wraparound services. We also provide the medical, because as you probably know, people with serious mental illness die 15 to 25 years sooner than the general population. We provide the psychiatric, and what we do with the psychiatric piece is we look really to give people the best medication with the least side effects. And we also provide housing. We provide helping people get their benefits. So it's a whole series of things that allow people to get better. So without that piece, which very few people get the opportunity to have, they continue to deteriorate. So now, to get to your question, I'm not going to deny that there are a few people out there that may require long-term hospitalization. Now, the use of asylum, that's kind of a buzz phrase, right? Yeah. I mean, I would like to say dignified long-term hospitalization for those individuals where we have not yet found the answer and are searching to find it. But I don't want to give the impression that we need to bring it back in mass and say, oh, we're giving up on people, because that's the last thing we want to do.
So finally, how do we replicate this model? I know that Fountain House and other community-based models for dealing with the mentally ill are now receiving international attention. You have people coming in from all around the world asking, how can we do this? So what's the best way of sort of spreading this model?
I think people have to understand how cost-effective this model is. The members do most of the work to run the clubhouse voluntarily, and we need very little staff to run this. It's members and staff working together to run the clubhouse. They can start very small. Now we're replicated in 300 clubhouses around the world, in 34 countries around the world.
Less expensive, and it's effective
Right.
What else?
So what we are doing right now, and we just finished our big international conference where we did have people from all over the world come. Our mission now is through WebEx and through other learning exchange methodologies using latest technology, we are available to help whomever, especially in low and middle income countries. We want to be available to them to help build mental health systems, because in many countries there might be one psychiatrist for 50 million people, and we want to be available to help and show that there's an alternative. We're not denying the need for quality medical and psychiatric, but we want to be clear that it could start by building a community, and that community could be as simple as a small little home, small little house.
The key word being community, so
Right.
important. Dr. Ralph Aquila, Betty Eastland, thanks to both of you for being with us.
Thank you so much.
And